Hi, and welcome to Cave Talks. I'm Kimberly, and I'm the program director of My Quiet Cave, where we create space for faith and mental health. And today we have with us Mary Ellen Mann. Mary Ellen is a licensed clinical social worker here in Colorado, and she is an author and a speaker specifically on sexual trauma. And I know this is an incredibly difficult topic to talk about, but what I really love about what you do, and in your own words, you say you like to make mental health beautiful. Mm-hmm. I just love that. Can you tell me a little more about that and why trauma?
Well, it kind of fell into my lap, and I think it became something I realized more as I was studying it that I really did understand. And one of the things that I think is missing so often in mental health is the idea of working through recovery is so physical. It is mental, but I think what we forget, sometimes, not everyone, but what I've seen people do is they put people in austere and fairly unattractive environments, and then they ask them to feel comfortable, and really I try to create an environment that's taking care of the five senses. So how does something taste, smell? What are you looking at? Is the lighting okay? I have sound and all sorts of things in there to help calm the body down, because if we can get a calm body, we can ultimately get a calm brain, and with a calm brain we can get really so much more self-observing, whether that is trauma or it is something else that's really disturbing. So it needs to be worked through. So if we can make it beautiful for people to be in therapy and to see it as an act of bravery and courage, to see it as an act of, I think, self-responsibility and even civic duty to really add value to the world. And the more we're taking care of ourselves physically, the less everyone's paying our health bills. And also, I think the same goes for our mental health. The more we're able to take ownership, the more we're able to be contributors and really bring out the best, I hope, in other people.
Well, I've never heard it put that way before, but I love that, how you say, it's our civic duty, because we become contributors to the world when we take care of ourselves. I've never really thought of that. So often we get very tunneled and it's just about me, but it's really how can I contribute and be a part of everything.
Right.
I love that. So when we're talking about trauma, what do you mean trauma?
So basically, it's a situation where it could be a little t trauma or a big T trauma. It can be an accumulation of little t traumas that feel to your body like a big T trauma. And the reason we put them in different categories is that sometimes people don't realize something that happened to them is in fact perceived by your nervous system and therefore your body and your mental health as something that was overwhelming. And so it could be something that was overwhelming over and fast, and it was everyone agreed it was a problem. It can be something that was happening to you repeatedly in secret, and the shame and the stigma of a situation like sexual abuse, and nobody wants to deal with it. And so you have that big T trauma of the event of having your body overwhelmingly violated and being rendered powerless, but also silent. And we have a lot in our culture right now talking about, like with Me Too and Church Too, the reality of re-victimization. And so you might have the events of violation, and now you have the re-victimization that will certainly compound all of these symptoms of trauma. So trauma in itself can be a situation where you were rendered powerless and it was felt to your system as overwhelming. So it could be rear-ended, at a stoplight, and now you suffered whiplash, and now you're in your car again, and you're at a stoplight, and your body seizes up when you see a car moving to the back of you. It could be, you're smelling something that reminds you of the night you were assaulted. It could be that you're smelling the cologne of someone that was in your family that groomed you and were setting you up for sexual abuse, but in fact the physical events may not have happened. I mean, it can be anything triggering these reactions. Trauma is felt in the body as like an amygdala hijack, basically. The back of your brain will over-inform the front of your brain, this is danger, it's overwhelming, get anxious, seize up, and either make your body really tight and vigilant or numb out completely, depending on both personality and the level of which, the trauma was experienced.
You said something that I wanted to go back to when you were talking about the cologne, smelling the cologne of somebody that was grooming you, but nothing happened. So can you still be traumatized, or can you still experience trauma when there was an imminent threat or a perceived threat, but then it doesn't happen?
So the threat was real, yes,
Okay.
and it was perceived as something that was probably not going to be believed if you talked about it, or you felt like it was in your head, or you did try to talk about just the grooming, if you will. And people were like, come on, he's a nice guy. You really can't trust your instincts. Come on. The big core event of all violation against the body, and typically that comes with trauma, is a concern about being able to trust your judgment. And that I have said that forever. Like, if I can, as a therapist and obviously working through my own stuff, if I can get to a place where I can really feel like good 80 to 95% of the time I can trust my judgment, that is the signal for me that I'm on the other side of the trauma really defining my everyday existence.
So we were going to talk about, and I can cut this, complex trauma. Is that what we want to kind of differentiate between that and PTSD? So
Yes.
can we talk a little bit about this idea of complex trauma?
So complex trauma is not a real formal diagnosis. It's not going to be in something that you could identify a patient with, or that insurance records would actually identify as a true ICD-9 code. And so if you were dealing with someone with complex trauma, you would give them really the ICD-9 code of PTSD, because over 90% of the symptoms that someone with PTSD experiences overlaps with your classic understanding of PTSD. Complex PTSD usually arrives in the person's life through relationships a person thought they could trust. So this could be the father, the brother, the sister, a cousin, a coach, usually it is a person we thought we could trust in a position of power. We thought they would protect us, look out for us, and in fact they used that to leverage themselves to be trustworthy and therefore have access to us. This can also be, CPTSD can be a result of date rape. It can be a result of rape in marriages. 1 in 7 marriages is contending with this. It can be believing that you could go into a room and talk to a church elder, and it turns out now he's sexualizing you, or there's some form of either revisiting an issue that you had growing up, and that now we have a compounding event and the person is overwhelmed, shaking, and experiencing the exact same symptoms someone might be experiencing from being in war, by hearing a car backfire, at an intersection. That person is experiencing the same overwhelming experience of being that they can't actually gauge time and place, or a level of control, or how to plan to take care of themselves. Their body is just soaked with stress hormones at that point. So it can be difficult to trust your own instincts. That's probably one of the biggest injuries. Maybe they have physical injuries and they have body memories, but the process is knowing, now this person I can trust. And so as a therapist, you can imagine I have a lot of work to do to make sure I'm trustworthy. And I appreciate that.
Yeah, I'm sure, because you are in a position of power.
Yes.
And they've been hurt by people
in position of power who've either let them down, not believed them, or have actually went and harmed them. Trauma is also, it's important to say, because a lot of people have a hard time understanding, well, people get hurt and life is hard and there's a challenge. So why are we talking about something that can hurt you being traumatizing? And I think it's very important as an advocate for people who've gone through trauma that we're really not talking about hurt. We're talking about harm. And so the dentist might hurt me by pulling my tooth, and like abscess, it's infected, it's really painful, or I have surgery on something, or they have to re-break my nose, whatever. I mean, it's painful, they're hurting me. But is the outcome to harm me? And hurt to get to a place of getting well, or I'm challenged to grow in a certain area. It was hard or hurtful or challenging to hear that I wasn't a good leader that day or something. But harm is demoralizing. It's undermining me. It is bringing me to a place of doubting worth. The dentist isn't going to make me doubt my worth, but I am in a challenging situation. So I like to make sure to, anytime I'm talking about violation, to make sure it's clear that it's under the harm category. As common sense as that may be, there are a lot of rationalizations out there.
Right.
Yeah.
No, I think it's really important to differentiate. I haven't heard that before.
Mm-hmm.
So harm would be more intentional.
Mm-hmm.
I'm trying, like you said, demoralize you, so it has more to do with trust as well.
And so that's the complexity of working through this type of trauma. And veterans, I'm sure, can talk about like thinking they could trust someone who was allied with them and maybe there was something that went wrong. They would then say, I realized I couldn't trust them, and that is complex trauma for sure. Most of the time we're pretty aware with all the recon, like who is the enemy. In these situations, we don't have that information. We're not paid, we're not trained. We are truly standing in a highly vulnerable position.
So you've talked a little bit about what that looks like in people or situations. Can you talk more about what that would look like in the everyday person that's experienced this CPTSD?
Well, and a lot of the symptoms I had mentioned are going to be the same as PTSD. And the big deal, most people think of PTSD as flashbacks, and those are very real and significant to a survivor of trauma. But a lot of the time, it's the everyday just living soaked in stress hormones. And the reason I like to clarify that is people won't understand, why did I suddenly, I lost my vision, or my dentist, I'm having more cavities all of a sudden, or I have all this bone loss, or I have this really high cholesterol number now, or I'm like diabetic almost, diabetes 2, I've had less sugar in my blood, I don't know what happened. Suddenly people will have IBS and or migraines, they'll have TMJ, they'll have myopia, right? So they feel like they're in tunnel vision in and out of the day. And that to me is the significance, is that it's truly, they say trauma is like adding a drop of red paint into a bucket of white paint. And so it just moves through your whole system because your brain is all over your body. So it will be reacting to perceived threats. It doesn't know what to pay attention to as a threat and what to let go of. It doesn't know necessarily even how to prioritize, is that the worst threat or is that the worst threat? They can't, because that's so prefrontal lobe. And prefrontal lobe is like decision making, it's linear, it's language, it's being able to handle and ask for what you need and know what you feel, and that kind of thing just goes offline. So the Broca's area, which is this language center and the parietal area and the anterior area, they'll look at scans of brains being exposed to the subject matter that traumatized them. And it goes black, like there is no metabolic activity except in the back. So you have your sympathetic and parasympathetic systems, those are two branches, and they're all overactive in the back, and nothing is here going, hey, it's over, you're safe. Your body's literally in the stress hormone soak. And so all of those various things can be taking place. Of course, your thyroid, you can have symptoms of ADHD because your adrenaline shoots to the front of your brain, and then it just overloads your cells and they rattle, die, and then the connection dies, and now we have what can look like ADHD. We can have intermittent explosive disorder. We can have dissociative disorder. We can lose time and place. Of course, there's depression. Some people, their anxiety is so in flux that they will look mixed mood and require some mood stabilizer. And of course, you can imagine with this stress hormones flooding the system all day, the night becomes even more wicked. The night people describe with CPTSD as the time of doom. It's not a time of sleeping, it's a time of vulnerability. Lights turn on, they're up and down. And of course, the more you're not sleeping, the more you, of course, will engage more stress hormones. So it is it is a neurobiological event, not because people are negative, not because people don't have faith, but because we have not reconstructed the body's understanding that it is over and now you are in control. You have the right to talk about this, you have the right to ask what you need, you have the right to hate what happened to you, and visit all the emotions that you couldn't visit before, and obviously have a felt sense of safety. Sometimes that's through medicine, a lot of times it is. We really need a lot of recorrection because those poor hormones are super whacked out. So one of the things that, as much as I think we have all these anatomical and physical elements, you can imagine we're socially wired, right? And so if I am operating off this frequency that everything is threatening or it's out to get me or it can't be trusted, then that's going to impact how I am with people. And I can definitely tell you that, I went from a person in high school who was kind of known as gullible and naive and just say, no, Mary Ellen is like nice to everybody, to a person that was quite shut down. I had learned that I believed at least that it was my being naive and being open and kind that was what got me into trouble. And I believed that when I was giving, I was going to be taken advantage of. So I went from, you like that sweatshirt, you can have it, to I need that back, really self-protective and really into self-preservation, because the idea of feeling like, see, I can't trust that, I can't trust this. And these are like some really core people, from family of origin to old friends to I was married once before, and all of those things, just the wheels popped off. Everything I thought was real wasn't real. And in terms of honesty, integrity, and what I meant to people and how I was going to be treated if I wasn't on guard, then it just reinforced, see, you have to be guarded. And I was also sexually harassed, and all of this took place in Christian environments and around Christian leaders and youth pastors and professors. And I won't name all the places because it might feel upsetting to people, but I had to overcome, like, these are faith-based people and they are not going to look out for me. And so it has been a long journey, frankly, and that's why I felt compelled to write the book, because it's not easy answers, and socially I had to heal. And I've thankfully let go of a lot of my, fairly burdening walls, because I realized those were controlling my personality. And as much as I might be keeping myself safe, I was definitely also exhausted and depressed. And one of the simple phrases I had heard at one point, I was training for a marathon and then a triathlon after that. So being physical and in shape really does help calm down a lot of these stress hormones. And I had heard someone say, be the change you want to see in the world. And I thought, that's my mission, is to live, for me, past the control of trauma, is to be the change. That takes a lot of concentration though, because you're having to literally go, yep, that blender could turn on with my hand in it, and I got to keep my hand in it, and I have to hope that blender won't, it's not plugged in, okay, Yeah. And so it takes a lot of fortitude and realizing, like, nobody wants to hurt you like that, or most of the time people don't even think about you. They're not definitely trying not to harm you and undermine you. While that is true and it did happen, that's not happening now. And a lot of journaling and a lot of processing. I will see that in all of my clients. That's why being able to trust your judgment again is the largest, it's the Mount Everest. And if we can get to the top of that and get down the other side, we're definitely, the body overall is in a much better space with people. As you can imagine, there's just a lot we have going on.
Yeah. Mm-hmm. So what kind of resources, you mentioned medicine, what kind of resources are there available?
Well, a lot of people, I just read this article literally this morning talking about 21st century therapy, and that it's no longer above the neck, but below the neck. And 21st century therapy really is, noticing, where do you feel that in your body? What is your body wanting us to understand about this right now? There's EMDR. That's the classic understanding of how to engage the body, to keep the body calm so that the brain can engage the new understanding that it is over. There's brain spotting, which I'm a huge fan of. It was developed by a guy named David Grand, who was a huge EMDR guy. And he's now come up with brain spotting to do more accelerated healing than even EMDR. There's IFS, which is integrated family systems, that I love, looking at defense mechanisms that we might have against getting well. I use essential oils, I use weighted blankets, I use Delta sound wave you can find on YouTube. I do low lighting, I do tactile pulsars, just anything that's bilateral that a person likes. So anything I can do to quiet the back of the brain, to set the autonomic system, which is the sympathetic and parasympathetic, at a calm place, and then we can start doing therapy. If you just do insight-based therapy with this kind of stuff, like, well, just remember you're important. Well, just remember, you can trust yourself. Okay, well, just remember, and it's not negative or evil, of course, but it's just, I had a guy in my office today, and I said, did you hear that I said you're worthy? And he said, no, I can't hear you right now. And so we had to do some body work before he could even hear what I was trying to tell him. Right. I lost him. He dissociated for a little while. So, and he was horribly bullied growing up. So, and then had a number of addictions to try to compensate for that. So you can imagine with a body that's soaking in stress hormones, we have a lot of addiction with this. So what we're trying to do is make everyday life okay, that it's okay to be okay.
So what does recovery look like?
The big idea in recovery is congruency. So your outsides match your insides. And because the big event of trauma is my outsides are so overwhelmed, my insides have to leave. So we want the insides to come back in, and we want the outsides to say, I've got you. And if you're mad, that's okay, and no one's going to die. If you need this, that's okay, and you should need, it's fine to need that. If you're feeling this way, that is a part of the recovery process. So it's congruency, so the insides are matching the outsides, and I would also say congruency so that one can be more transcendent. And the idea of it is to be able to say, and I think I'm using the word transcendent for having the capacity to realize that what happened to you was related to the person, not to you. Your body was there. But this person would have acted out with someone else. And that as much as it isn't personal, it's also not your poison to drink. And so you have the right to go on living. And I think that to me is the ultimate transcendency, to be able to see it from the perspective of the future and as well as the present, from things as simple as, how do I want to end this weekend? What do I want to know that I have done? I want to create my memories right now. I don't need to just be in the present going, oh my gosh, I hope I can be okay the next 5 minutes, but how do I want to feel in 2 days? And why, what can I do even for post-traumatic growth? And there's a big subject about that. A lot of us therapists are in post-traumatic growth, right? We are giving people answers and care that we needed. And it's what makes us good at it. It's just like a physical therapist who's an injured athlete is really good at what they do right. Because they know what it feels like. Yeah. And so they're in post-traumatic growth, if you will. That's a similar thought. So we have a lot of injured people out there, and trauma is an injury. It's not a mental illness. It can lead to mental illnesses because of those stress hormones, but that's not how it started. And the earlier trauma entered the system, the more it is in control of your nervous system. If someone had a pretty easy life, really everyone loved and liked them a lot, they felt pretty stable, things worked as planned, and then kabam, they had a pretty life-altering event in college, we won't see this level of physical reversal. If we had recycled trauma, especially in the same kind of way, it was this trusted person and this trusted person, we will see much more severe symptoms of trauma. So that's important for people to understand.
Mary Ellen, thank you so much for being here and talking about something.
Thanks for asking about it.
Yeah, it's a difficult topic, and it's something I think that's very misunderstood.
Mm-hmm. So I'm glad to be here to help out with, I hope, helping people feel less alone and ashamed and stigmatized by what they're going through.
And you
have the last thing that should be happening. So
yeah. And you have resources on your website?
I do. So yes, my website, MaryEllenMann.com, and we have a lot of information about who I am and trauma, abuse. We have everyday healing practices that you can download. We have acute healing, symptom recovery, so that you have like access to how to do some of the stuff I've talked about. and make sure your body's back in control again. I don't make medical recommendations or anything like that, but I do have some things that I use in my office in treatment that you can download.
Right. And we want to say again, we're not trying to encourage anybody to self-diagnose or diagnose a friend here with this, but there's great resources out there, and we could just encourage you to look those up. And your website, Mary Ellen.
Yes, MaryEllenMann.com.
We'll put that up on the screen too.
And I also forgot that I wrote a book called From Pain to Power, and it is overcoming sexual trauma and reclaiming your true identity. And I had a chance to get that published about, almost 4 years ago.
Oh, that's awesome.
Yeah, it was great.
We can put a link to that as well.
Yeah.
So thank you again for being
welcome.
here. And if you would like to see a topic of your choice as a cave talk, please go onto our website. It's myquietcave.org, or you can shoot us an email. We'd love to hear from you. We'd love to hear feedback, your suggestions, and just ideas for other interviews that we could do. So thank you so much for joining us today, and we will see you next time.